This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended.
Hi, this is Dr. Deepak Megur and I'm here with an interesting case. A question for you all. The rhexis is circular before implanting the lens. Once the lens is implanted, it changes its shape. Why does this happen? Let's find out. She is an elderly lady who has this dense arcus and a dense cataract. Let me begin the surgery at the rhexis stage. Now note, as I'm trying to puncture, there are multiple radial folds appearing at the puncture site, suggesting some degree of anterior zonular weakness. The flap is raised and an appropriately sized 5mm rhexis is being created. I'm trying to look for any folds near the tearing edge. There are only few, but what I'm distinctly noticing is the rhexis tear is not easy. It's taking some effort to tear, suggesting some degree of zonular weakness. Nevertheless, I have an appropriately sized rhexis, which is central and circular. Gentle hydrodissection is done. Chamber is pressurized with OVD. Nuclear mobility is confirmed. Time to perform phaco. The superficial epinucleus is removed. The nucleus is being divided using the vertical chop technique. This is the first chop. The nucleus is rotated and the second chop. And finally, the nucleus is divided into multiple small fragments and then consumed in a controlled manner. Of course, the nucleus is dense, so I need to be careful to work at a slightly posterior plane that's at the level of the rhexis margin, and I have used enough OVD to protect the endothelium. The last fragment is carefully emulsified. Once the last fragment is consumed, we can clearly see that the rhexis continues to be circular and central. Time to aspirate the cortex. Bimanual I&A is used to strip off all the cortex and then aspirate it. The rhexis continues to be round. OVD is injected into the bag to form it, and then the planned multi-piece IOL is injected into the capsular bag. The moment both the haptics are in the bag, I can clearly see that the shape of the rhexis has changed. It has become oval. Well, I thought if I remove the OVD, then probably again it becomes circular. So I proceed to remove OVD both in front and behind the lens. Even after complete removal of the OVD, the rhexis continues to be oval. It is no longer round. Well, it suggests something. Okay, let me just describe the shape of the rhexis now with respect to the haptics. We have the optic-haptic junction here, and the terminal edge of the haptics are 90 degrees away from it. And if you look at the shape of the rhexis appears to be stretched diagonally, conforming to the meridian of the endpoints of the haptics, suggesting that the bag had a generalized zonular weakness and now it is being stretched at one meridian itself. And that's the reason why the rhexis from its original circular shape has now become oval. So it is a clear-cut confirmation of a generalized zonular weakness in this patient, probably secondary to pseudoexfoliation, and such cases warrant a CTR. So the bag is inflated with OVD once again, and a CTR of normal dimensions, that is 11 and 13 mm, is gently being threaded into the capsular bag. It's not difficult to thread the CTR in the capsular bag with the IOL in situ. The only trick is to keep the bag very well formed with OVD. And gently but surely the CTR is threaded into the bag. And once the CTR is in, immediately the shape of the capsular rhexis changes. Now it has become circular once again, changing from its original oval shape. So why did this happen now? Originally, the stretch was only in one particular meridian. The moment we used a CTR, it provided 360 degrees equatorial stretch to the capsular bag, as a result of which the circular shape of the rhexis was restored. So the lesson learned through this case: if we have a change in the shape of the rhexis after implanting the lens, then it could indicate the presence of diffuse zonulopathy and could warrant using a CTR to provide 360 degrees equatorial stretch and support to the capsular bag. Thank you for watching and hope you found this helpful.